We move on to the next, oh my God, exam, class 5. This is about megaloblastic anemia, part 1. The important thing will be the absorption of B12. B12 is taken by diet, and there is a substance called R binder secreted by the salivary gland. The R binder and the B12 go to the stomach wherein it is released. The intrinsic factor secreted by the parietal cells get attached to the B12, and this complex moves lower down and gets attached to the ileal receptor. Look at the R over here. And after which you find that there is the release of the intrinsic factor, B12 is absorbed, and it is carried by means of transcobalamin. There are 3 types of transcobalamin. It is deposited in the body tissue such as the bone marrow, liver, and adipose. This absorption we shall be knowing, because there can be a defect in all of these, which I shall be explaining. Pernicious anemia is an autoimmune disorder wherein there will be antibodies. There can be an antibody to the parietal cell, antibody to the intrinsic factor, something that is blocking the binding of the intrinsic factor and the B12, and also the binding of the intrinsic factor to the receptor. They are called blocking antibodies and binding antibodies. The causes for B12 deficiency include all this. One is a pernicious anemia, gastrectomy, any form of surgery or malabsorption, parasitic infestation, Diphyllobothrium latum and MCQ, bacterial overgrowth and diverticulosis, increased demand in pregnancy, disseminated cancer, and metabolic inhibitors. Antibodies we shall be mentioning. So this is the absorption. There is the intrinsic factor. This can be blocked by means of the blocking antibody. And then there is a binding antibody which prevents the binding to the receptor. Causes of folic acid deficiency, all eyes. This you people can read up. Inadequate diet, impaired absorption, increased loss, increased requirement, impaired utilization, irresponsible or unresponsive to therapy. So these are the various causes: malabsorption, hemodialysis, drugs such as anticonvulsants, you people shall mention. This is an important cycle which you people must write in the pathogenesis. This is, we'll first finish the folic acid. Tetrahydrofolic acid, methylene tetrahydrofolic acid, again converted to dihydrofolate, back to tetrahydrofolic acid. In the process, you find it acts as an enzyme for the conversion of the deoxyuridylate to thymidylate to DNA, thymidine, and finally DNA. Also, there is a methyl tetrahydrofolic acid which is converted to tetrahydrofolic acid. For this, you require the conversion of homocysteine to methionine. So if this is going to be defective, B12, then the process of folic acid metabolism will not happen. So this is called the folate trap. This you people shall and will mention. So this is the folate trap that has been shown. Homocysteine is converted to methionine. And when there is going to be a defect in this, you find that the DNA will not be formed. Homocysteinuria is the condition. Thank you.